Hi, Mr. Vasoo. Morning. How are you?
Good.
What are you looking forward to most after the surgery?
A better life. A better future.
Okay, good. I'll see you inside. Most of the patients that come to see me are already been obese for a long period of time. They get laughed at in secondary schools. They have difficulty fitting into society. Now coming for the COVID sleeve gastrectomy. Patient side don't consent.
I feel shame, you see. Definitely what? You feel shame what? I said, I think I better do something. I don't want to stay like this anymore.
Starting, First entry point.
For the past 2 months, Vasoo Kesavan has been coming to Khoo Teck Puat Hospital to see Dr Tan Chun Hai, a bariatric and metabolic surgeon. Vasoo has been overweight since he was a teenager, but he gained even more weight when he started to work as a private bus driver in 2014.
Because it's too relaxed, the road. You drive, you eat, you sit down, you drive, you eat, you sit down, you drive. There's no exercise. So I'll be just eating and drinking. I couldn't control myself. It was everything like haywire.
When his weight reached 212 kilograms, and as a result, he lost his job, Vasoo knew he had to do something.
Obesity now is being classified by WHO as a chronic relapsing disease, which means you may have some success in losing weight initially, but they may come back at a later date.
What's your weight, Mr. Vasoo?
1206, eh?
With a body mass index of 70, Vasoo is at high risk of developing serious health complications. Already, he suffers from chronic asthma.
I walk little bit only, my asthma.
And a knee injury makes even walking difficult. According to Dr. Tan, changing one's lifestyle and diet is usually more effective if you're overweight or class 1 obese, meaning your BMI is between 22.6 and 32.5. Vasoo is well outside this range.
For such category of patients, the most effective would be surgery.
But before Vasoo can be scheduled for surgery, he needs to lose some weight. 10 to 20% of Dr. Tan's patients need to do so due to their unusually high BMI. For Vasoo, Dr. Tan has set the goal weight at 180 kilograms.
Mr. Vasoo has got a thicker layer of fat that the surgical instruments need to go through. Being on the higher BMI scale, his liver will be more fatty and it may obscure the area of our surgery, which we can see. So that's why we wanted him to lose some weight in the pre-operative phase to make the surgery less risky.
To achieve such rapid weight loss, Vasoo has to go through a customized 6-week plan. It starts with 3 weeks of dieting and exercising at home,
Is it good?
It's vanilla flavor, it's very nice.
followed by 3 weeks of hospitalization, where the dieting and exercising regime intensifies. Two weeks into a 6-week plan, Vasoo has managed to shed 6 of the 32 kilograms he aims to lose.
Good afternoon.
How are you?
Good.
Do you feel the difference now, 6 kg?
The thing is, I feel light. My stomach feel light. That's all I can tell you.
Initially, he did struggle when he first started the very low calorie diet. Okay, usually the first few days, usually there will be a drop in energy level because there's a drastic change from eating to not eating. However, now he's actually better in terms of energy level and also controlling the hunger as well.
Apart from the dietitian, Vasoo also has an appointment with the physiotherapist. They are part of a team of healthcare professionals that will see him through his weight loss journey.
So just as usual, we'll be checking on your blood pressure and your oxygen.
Why your pulse so high?
breathe from here. Yes.
Dr. Tan is called in to assess Vasoo's condition.
I mean, the highest it goes is like just now 98, 96.
You might need to stay in hospital.
Doctor, please don't want.
It's not whether
I'll be okay.
It's not whether I want or don't want, okay? If it's not safe for you to go back, something might happen to you from now until next week.
For only 20 days. From today you count 20 days. If you cry, you're making me sad. I cannot have a peace of mind there. Whenever I go out, I see different fathers enjoying life with their children. Play hide and seek with them, chase them around. I just want that. My children are the most important thing to me. Hi. How are you?
How are you?
Good.
3 weeks before the scheduled surgery, Vasoo checks into the hospital as planned.
He will stay in the hospital to have a longer period of customized exercise regime, as well as various specialties to come and access. This is a standard preoperative workup for all bariatric patients to reduce the risk of surgical complications.
As Dr. Tan has feared, Vasoo's surgery will need to be postponed to the new year.
The results of his workup showed that he actually had a heart condition that needs to be treated and monitored by the cardiology team prior to surgery.
In early 2020, Vasoo's surgery is delayed indefinitely by the reallocation of hospital resources to tackle the COVID-19 outbreak.
Two, 3 days back, I was really down, like I was looking for a job to work. Then Mr. Tan suddenly called me and he told me, I got a good news for you. I've already made an appointment with your operation and the day is on the 11th of March.
There was a window in which the cases tapered down. Monday, Thursday, you weigh yourself. I want to see. Okay. And follow the dietitian regime. Can?
Sure, doctor.
Questions?
I'm very excited now for the third time. Oh my God.
Not too bad.
Not bad, not bad.
How are you feeling?
Excited and tension a bit.
Okay lah, relax, don't worry. Okay, so everything will be fine. Your weight loss prior to surgery is good. The physio has done their work. Your exercise tolerance has improved. So I think we should be a straightforward surgery.
Thank you, doctor.
So these are the extension pads that we have put in to support his lateral weight. This is the long sucker, standby long cords in case we do not have access to the intraperitoneal cavity.
Dr. Tan is performing a sleeve gastrectomy on Vasoo
Starting,
using laparoscopy or keyhole surgery.
Sleeve gastrectomy involves removing majority of the stomach, leaving behind what looks like a sleeve or a curved banana.
This reduces Vasoo's stomach by 60 to 70%, thus limiting how much food he can take in. It also suppresses his appetite for life.
The appetite hormone is being produced in one of the parts of the stomach which has been removed. Okay, so Mr. Vasoo's surgery took about 1 to 2 hours. You went as according to plan. Thank you, guys.
Going back home. Home, sweet home.
Vasoo's weight loss journey doesn't end here. For the next month, he can only have liquid and pureed food.
It's what they took out from my stomach.
And even when he's back on regular food, his stomach capacity is so small that he can't eat regular portions.
I have to do my homework now. Do my diet properly. Don't be greedy.
About 20 to 25% of what a normal person will eat, he won't be able to eat more, he will vomit. And it's a negative reinforcement. Most patients, when they come to see me, they are very motivated to get surgery, and I usually tell them that surgery is not a magic pill. They need to combine surgery together with lifestyle modification, as well as watch their diet to improve their health.
Dr. Tan also advises overweight patients to seek help earlier, before obesity-related health complications develop. For those with a BMI greater than 32.5, they should consider surgery when all other treatment options have been unsuccessful.
My biggest size. See. Checked my weight yesterday morning. It was 162. Before I was like, I sit down here, I can't even walk to the kitchen. Anything I'll ask my daughter, please do this. Last time I was thinking that I am going to be like this for the rest of my life.
The post-surgery results vary from patient to patient. For Vasoo, losing weight is still a work in progress, but it's meant that he can go back to work and be a little more active.
Right now, I feel something new lah. I feel like going on. People look at me also, they just normal only. They don't look at me like, wow, you see this guy so fat. They don't say that. This is me.